We've told you about recent efforts happening at the Missouri Capitol to help relieve student loan debt for new physicians. Well, now that's finally a reality for health professional students. Reagan Trolio is joining us live this morning. She's outside of Cox Health to remind us what folks have to do to get those loans paid off. Reagan, good morning.
Hey, Jackie. Well, you have to work in high-need areas after school, so urban hospitals like here at Cox Health wouldn't make the cut. Now, I talked with the sponsor of this legislation, but I also sat down with a rural doctor who is all for getting more health professional students into rural hospitals. You're the only physician in Reynolds County, correct?
Yes, yeah. So I am, to my knowledge, I am the only physician in Reynolds County that does primary care.
Dr. Ian Pelletier is a doctor for Missouri Highlands Healthcare in 2 rural Missouri counties. He says similar loan incentives got him to where he is now.
That's why I'm even here to begin with. I've since kind of love these areas. I very much appreciate the community and like being here. But because I probably would have been in a different area if it wasn't for the loan repayment program.
House Bill 402 establishes a health professional loan repayment program so the other healthcare workers can take advantage.
You calculate how many lives, how many patient years are saved by having a provider in an area, and the math works out drastically in favor of these loan repayment programs being good.
Representative Mike Henderson sponsored this legislation.
I think one of the larger healthcare bills that we passed in many years.
He says there's many moving parts to the new law.
It allows these hospitals to designate themselves a rural emergency hospital. They have to change a few things in the hospital, but both sides win out of it. They get an extra, it makes them eligible for an extra $2 million a year of federal funds.
But that's not all it does for rural communities.
It guarantees that in that rural hospital that they would have a 24-hour pharmacy and a 24-hour lab available. Now, in the Springfield area, you probably have with Cox Health down there, you have plenty of options. But in some of these rural areas, this is going to keep those hospitals alive and working so that they don't have to drive an hour to 2 hours away.
And physicians like Dr. Pelletier are real-life examples that these loan incentives do work.
I think a lot of these communities, you get the right physician in there, you get a person in there, they'll probably fall in love with the area. Like generally, I very much love taking care of the patients that I see. They are really appreciative. They're like, hey, I'm so glad to have a physician here. We're so thankful that you're here, and it's generally really rewarding.
And House Bill 402 took effect back in August, and I talked with Representative Henderson, and he told me if you're interested in learning more about this loan repayment program, to go ahead and contact the Department of Health and Senior Services. We have that info in this story on our website. But for now, live in Springfield, I'm Reagan Trolio, KY3 News.
Reagan,